A woman's jaw was completely shattered, not cracked, shattered, the joint destroyed. And someone looked at that and decided she wasn't going to die from it. They drilled 2 holes straight through the bone, threaded horsehair through them like thread through a needle. And somehow, that held her jaw together long enough for her to keep living. Months, maybe years. This happened 2,500 years ago, on a frozen plateau in Siberia, and researchers only figured out what they were looking at a few months ago. Here's what gets me about this one. We're not talking about a lucky break, or a wound that healed on its own. This was a deliberate, engineered fix. Someone diagnosed a catastrophic injury, built a solution out of bone and hair, and installed it in a human skull, before metal tools were common in that region, before anyone had a word for prosthetic. Let's back up. In 1994, archaeologists dug up a burial site called Upper Kaljan II, way out on the Ukok Plateau in southern Siberia. This is Pazyryk territory, an Iron Age nomadic culture related to the Scythians, the horse-riding warriors Herodotus wrote about, famous for elaborate burial mounds, famous for insanely detailed tattoo work, famous, honestly, for being tough. Among the remains there was a woman, early 30s. Nothing about her looked unusual at first glance. Fast forward to this year. Researchers at Novosibirsk State University pulled her skull for a fresh look, using a CT scanner and a method that let them digitally strip away preserved soft tissue without touching the bone itself. 551 ultra-thin scan slices, a full 3D reconstruction. And that's when things got strange. The right side of her jaw joint, the temporomandibular joint, the hinge that lets your jaw open and close, was destroyed. A depression fracture. Probably a fall, maybe off a horse, which, for people who lived on horseback, wasn't rare. On its own, injury like that should have ended her. Not immediately, but slowly. Can't chew properly, can't eat enough, infection sets in, and you're gone within weeks in a world with no modern medicine. Except she didn't die, because right there in the wreckage of that joint, researchers found 2 channels drilled through the bone. Precise, about 1.5 millimeters wide, crossing each other at a right angle. Threaded through those channels, traces of what was probably horsehair or animal tendon. Think about what that actually is for a second. It's a ligature, a hand-built replacement for the ligament that used to hold her jaw together. Someone looked at a joint that no longer worked and built a new one out of the materials they had. The lead radiologist on the project put it plainly. They'd never seen anything like it in the scientific literature before. This might be the earliest documented case of this kind of surgery anywhere. Now, did it work? Kind of. That's the honest answer. The CT scans showed new bone growth ringed around those drilled channels. Thick, dense growth, which only happens if a person is alive and healing for a long stretch afterward, months, possibly years. So the fix held. Her jaw could move again. But here's the detail that makes this feel real instead of triumphant. The teeth on the left side of her mouth were noticeably more worn down than the right, chipped in places, which means she basically never chewed on the injured side again, probably because it still hurt. A lot. She lived. She just lived in pain, favoring one side of her own face for the rest of her life, because someone's emergency fix got her that far and no further. And she wasn't an isolated case in that culture either. A different Ukok mummy, studied earlier, showed clear signs of cranial trepanation, deliberate holes drilled into the skull, the patient surviving the procedure. Combine that with this jaw case, and a pattern starts to form. The Pazyryk weren't just warriors and horse breeders. They had people who understood anatomy well enough to intervene, directly, inside a human skull, more than once, with results that actually kept people alive. I want to be straight with you about something, though. This wasn't hospital-grade medicine. There's no anesthesia here, no sterile technique. Drilling through bone near someone's jaw joint while they're conscious, using nothing but hand tools, that's about as brutal a procedure as you can imagine. She survived it. She also apparently lived with chronic pain afterward that never fully went away. This is a story about ingenuity under horrific circumstances, not about some peaceful ancient clinic. But zoom out for a second. A woman with a shattered jaw in an Iron Age nomadic community on a mountain plateau in Siberia should have died. That was the default outcome. Instead, someone around her had enough understanding of the body and enough nerve to open her up and rebuild what was broken with whatever the land gave them. Bone, hair, precision. 2,500 years later, a scanner in a lab finally read the evidence they left behind. So here's my question. If the only surgeon available to you had nothing but a drill and some horsehair, and the alternative was certain death, would you let them try? Let me know in the comments. Take care of yourselves. I'll see you soon.